Passive range of motion of the shoulder joint with a client in a supine position. The therapist's positioning needs to be in such a way that your center, the therapist's center of gravity is lined up with the joint. In this case, we're doing the shoulder joint, so my center of gravity needs to line up with the shoulder joints. My feet are wide enough so I have a stable stand. And I need to hold the client in a gentle but assertive way so then the client feels that they can relax. This is done with the client's full relaxation. The client is not helping in any way. The therapist does all the work. So I'm going to start with flexion and extension. So I'm grabbing the wrist of the client and just above the elbow, and I do the flexion in a sagittal motion. So that's flexion. I finish when I feel a resistance from the shoulder joint. I pay attention to the client's face to make sure that they're not in pain or restricted in that way. And then the return is extension to the anatomical position. So that's flexion. And that's extension to the anatomical position. Then we're going to do horizontal adduction. So the elbow is above the shoulder joint, and you simply bring the elbow across the chest. That's horizontal adduction. The return from this position is called horizontal abduction. Horizontal adduction, and then horizontal abduction. Then from this position, we're going to bend the elbow and we're going to rotate in lateral rotation, or also called external rotation. And the return is called medial rotation or internal rotation. Internal rotation needs to be stopped when the shoulder of the client comes anteriorly. So lateral rotation and medial rotation. A little bit of limitation here. Then we're going to return to the anatomical position and we're going to do abduction. Nice and slow, looking at your client's reaction. The return is called adduction to the anatomical position. Okay? And any joints that has two axes of movement, flexion and extension, abduction and adduction, can allow for circumduction. This is what circumduction looks like at the shoulder joint. Circumduction in one direction and circumduction in the other direction. You go slow and you feel the restriction of the joint and you work within that.